I'll just let more folks in as they pop in. But hello and welcome everyone. We are so glad that you could make it here today for our webinar, Certified for Success, the role of board certification in pharmacy. My name is Danielle Stubbs. I am the Associate Director of Student Recruitment and Diversity at the American Association of Colleges of Pharmacy, and I'll be moderating today's session. Before we jump in to our panel, I just wanted to give a super brief overview about what we'll be talking about today. So whether you're just starting out thinking about pharmacy as a career, or you're already on that path and exploring your options, today's session is all about helping you understand where specialty pharmacy can take you and how board certification can help you get there. So we'll talk a little bit about what specialty pharmacy looks like in practice, how board certification fits into your growth as a pharmacist, and what kinds of career paths are out there. And rather than just having me talk at you, we actually have a really great panel lined up of board certified pharmacists who can tell you all about their personal experiences and what their career path looks like. This event is also co-hosted by the Board of Pharmacy Specialties, which is the go-to organization when it comes to board certification in pharmacy. So with that, I'm actually going to hand it off to Alex Jean-Baptiste, who's going to talk a little bit about what BPS is before we dive into our panel.
Thank you, Danielle. Hello, everyone. My name is Alex Jean-Baptiste. I'm currently the Associate Director of Digital Marketing and Communications for the Board of Pharmacy Specialties. And I'm really excited to be here with you all today and share in this panel about careers in pharmacy and specifically about the value of board certification. For those who are not familiar, BPS is the leading certified body of pharmacists looking to specialize in pharmacy practice. BPS currently recognizes 15 specialty areas of practice from pediatric care to psychiatric, ambulatory care, and pain management pharmacy being the newest specialty area. So we actually specialize pharmacists, recognized pharmacist certifications for pharmacists looking to specialize in areas of practice that meet the needs of different patient audience groups and practice settings. And today you're going to hear from specific board certified pharmacists who actually serve as BPS ambassadors. These pharmacists have volunteered to share their stories, their career journey, and impact of certification on their practice and professional experience. And you'll hear a lot about, the benefits of board certification from their lens. And I also want to invite you all, if you're interested in learning more about board certification, to visit the BPS website, bpsweb.org, where you can learn more about board certification. And we actually have a BPS student pharmacist toolkit where you can find helpful resources to learn more about board certification, in addition to the Pharmacy is Right for Me website. So with that being said, thank you all for being here, and I'll turn it over to Danielle to introduce our panelists.
Awesome. Thank you so much, Alex. Actually, before we jump into introductions, I really quickly wanted to get a sense of who we have in the room. So just choose the option that best describes you. You should be seeing that poll pop up on your screen right here. So I just wanted to see if we have prospective students, so folks who are just thinking about pharmacy as a potential career option. Maybe you're a current pharmacy student, interested in learning more about specialty certifications, or maybe you're already a pharmacist interested in pursuing board certification and would love to just see who all we have in the room. And while you all continue responding to that, let's just jump into introductions. And Dr. Lewis, why don't you start us off?
Hi, good evening, everyone. I'm Dr. Donisha Lewis. I am a board certified pharmacy specializing in ambulatory care, so outpatient care. And I'm currently a clinical programs coordinator, and I work for a company that assists with accelerating specialty pharmacies or implementing specialty pharmacies across the country. And I'm looking forward to sharing more of my experiences with you all during the webinar.
Dr. Julie Ann Dopheide?
Yes, my name is Dr. Julie Dopheide, and I am at USC Mann in Los Angeles. I'm a professor of clinical pharmacy. I have a joint appointment in psychiatry and the behavioral sciences, but I am a board certified psychiatric pharmacist, and I spend my days working with adults and youth who happen to be experiencing mental health or substance use challenges. and I work with interdisciplinary teams and students and families and help the patients we serve and their families learn as much about psychotropic medication as possible. And I help our patients get the most benefit with the least side effects of their psychiatric medications. It's a really rewarding career, and I look forward to answering any questions that you have about being a board-certified psychiatric pharmacist.
Awesome. Dr. Small?
Yeah, I'm Steve Small. I'm a pediatric pharmacist by trade. I'm certified in pediatrics, critical care, and pharmacotherapy. And I also have an outside certification in nutrition. And I practice at University of Iowa Healthcare. But actually, my full-time job that I do every day is I work for Pharmacist Letter, a news source and continuing education company for pharmacists, where I make podcasts, webinars, and other content to share with pharmacists and pharmacy learners.
Dr. Hawthorne?
Hi, I'm Ashley Hawthorne. I am employed with Auburn University and I practice in critical care. So that's where I hold my board certification. I practice in the surgical trauma ICU at the University of South Alabama.
And let's just see what our results are. So it looks like most of your prospective students or current pharmacy students interested in learning more about board certification. So that's really awesome. So thank you so much for responding to that poll. So let's just jump into our questions. We have some questions pre-prepared for you, but hopefully at the end we'll have a few more questions, a little bit of time left for audience questions, and you can just pop those in the chat whenever you want to. But let's start off with kind of the foundational question, which is what inspired you to pursue a career in pharmacy in the first place?
So I can start with that question. So for me, as a child, I was really intrigued by my pediatrician. He was awesome. And so initially I wanted to become a pediatrician. And then in middle school, my parents enrolled me in this program where I was able to actually shadow a physician in the hospital for a day or two. And this was HIPAA compliant, so I didn't necessarily see any crucial or critical things with patients, but I did that and I realized, I said, I don't think I want to be as hands-on as they are. And so I started to explore other careers in healthcare where I could still be very impactful in patient care. However, I didn't necessarily want to have to be as hands-on as a lot of physician roles would have been for me. And so that's really what led me into pharmacy. And I also have an uncle who's a pharmacist. So started doing that research. And in high school, I started working at my local community pharmacy where my mom would get her prescriptions filled. She got me a job there. And so I've been working in pharmacy ever since.
Yeah, thank you, Dr. Lewis. I kind of had a little bit of similar, a little different pathway. At the corner drugstore where I actually grew up in Nebraska, there was a female pharmacist, and everybody respected her, and everybody went to her with questions. And you know, I was at career day in my high school, and they said, "Oh, you know, pharmacy is a great career for a woman. If you want to go and have a family, also, you can, you know, take time out for your family and get back into it. And it's a career of lifelong learning, and it's professional, and you have a built-in job at the end of going to pharmacy school." So those are some of the reasons that I pursued pharmacy, but then specializing in one area really excited me because it's really hard to keep up with absolutely everything. And so specializing in a certain therapeutic area or population, for me, it was psychiatry. That really kind of lit my fire, and I enjoy pharmacy from that perspective.
And for me, my mom was a laboratory technician in microbiology, and I remember going to the hospital and being fascinated by all the great things that they did there. And that sort of got me into the healthcare industry idea. And I loved biology, I loved chemistry. And I remember in high school, I took a psychology class where we learned about the mechanism of action, how antidepressants work. And I never thought, wow, we can know these things as pharmacists and use that info to help people. And then from there, I networked and tried to find ways to shadow pharmacists, meet pharmacists, found out I have an extended family member who's in pharmacy and was able to bounce ideas off of them and check out what the profession's all about. And here we are today.
And I have to say, I'm different from all the rest in that I never even considered pharmacy. I actually was really involved in like debate team and mock trial when I was in high school. And so I was going to be an attorney. My first couple of years of college was pre-law. And then I grew up on the coast of Mississippi. And so in 2007, I think it was, Hurricane Katrina hit. Well, my job, where I was interning as like a law assistant, was demolished. And I kind of really didn't enjoy my day-to-day job while I was there. And I just really like, it didn't make me feel good. It wasn't something I really liked being in the courtroom. I didn't really want to do the day-to-day task of an attorney. I just wanted to like argue people in court. But luckily, when the hurricane destroyed my job, one of my good friends, her father owned a local pharmacy, and a lot of his employees had evacuated. And so he was actually able to open back up pretty soon after. And he was like, I really need people to help. So I started going down and working the register. And then I kind of progressed into, technician and doing other things. And then I remember one day he says, why are you going to law school? And I was like, I don't know. I just really enjoy, courtroom stuff. And he was said, well, do you know where lawyers fall on the list of the most respected professions? And I said, no, I don't. He said, well, you know what's number one? It's a pharmacist. And so I was like, at that point, I started thinking, like, I really could see myself doing this every day. I enjoyed the job. It was kind of fast paced. I got to talk to people every day. I felt important, like I was doing something important. And so, yeah, that was how it happened for me.
Awesome. Thank you. Can you describe your journey into your specialty area within pharmacy?
Sure. So I can describe my journey. So I started out in community pharmacy, and then I had the opportunity to work inpatient clinical pharmacy, and I really enjoyed that. But I missed like that actual interaction with patients. So a specialty pharmacy opportunity came up, and with that opportunity, I really felt like that was a hybrid between my traditional community role and my inpatient pharmacy clinical role, because I still got to interact with patients, but I was going a step above clinically than I was in just a traditional community pharmacy. So I really enjoyed that, and then was able to expand that and open up some ambulatory care clinics where I actually saw patients, collaborated with providers to prescribe medications and all of that. And so I really, really enjoy that type of work, just being able to operate as a pharmacist at a greater capacity, but also working on these interdisciplinary teams and really showcasing what pharmacists are capable of. So that's really where I am now. And I love this specialty area. And so really pivoting, or I wouldn't say completely pivoting, but really being exposed to that clinical side, more inpatient, and matching that or aligning that up with my interest with community pharmacy is what led me into being into this specialty ambulatory space that I'm in now.
Well, as far as my pathway, I really felt valued in the mental health teams, the psychiatry service, where they're really interdisciplinary with the social worker and the psychiatrist, psychologist, a psychiatric pharmacist, nurse, and everyone's opinion mattered. Everyone was valued and everyone contributed. And I felt like I could really use my knowledge and experience and really develop a one-on-one rapport with the treatment team, but also with each of the patients that I saw. And I really enjoyed the fact that you have to get to know someone as a person and actually talk to them rather than just looking at lab values. In mental health, you really have to see what someone's symptoms are, what their experience has been, how they're doing on medications, and I really enjoyed that aspect, which what kind of triggered me to specialize in psychiatric pharmacy.
Yeah, and for me with pediatrics, it was not my first choice. In fact, I designed my entire pharmacy school career for infectious diseases. That is what I wanted to go into. But when I was in my first year of residency, I had an experience in pediatrics as part of my program, and it totally flipped the switch where I realized, wow, this is what I want to do. Because I realized that population is so vulnerable. Our healthcare system as a country isn't necessarily built for them. And a lot of pharmacists are scared of pediatrics. And we shouldn't be scared because they're patients just like you and I. So I felt that drive, that advocacy to really help that population. And they're such fun people to work with, both the patients and fellow healthcare colleagues. This is also right before COVID, a couple years. And now looking back, if I went to infectious disease, I don't know what I would have done to deal with the pandemic at the time. Uh, but yeah, I can't imagine me doing any other specialty at this point. And it was sort of just by chance that I took that experience, that elective experience, and ran with it.
And when I went into pharmacy school, I had really only known community pharmacy because I just kind of fell into it. So I had really not done a ton of research, was planning on just going to pharmacy school and working in the community. And I had interned with Walmart all through. They had a store for me when I graduated. That was life's plan. And then um, my first rotation in my APA year was infectious diseases. And I was like, I kind of like this. Like, I like walking around the hospital and being part of the team and like learning about the patients, and all this stuff started kind of coming together. And then my next rotation was a critical care rotation. And it was a faculty rotation, and it was in the trauma ICU, actually, where I currently work. So it's kind of like full circle now. Um, but I said, wow, like I have to do this. Like it was just the inspiration from witnessing my preceptor on the team and how they like asked him questions, and like he got to like actually make decisions, and they listened to him. Like when he told them that something needed to be changed, they did it. And so I said, yep, this is it. So it's just that one experience.
Awesome. And just a reminder again, while we do have some pre-planned questions, if you in the audience have any questions for our panelists, feel free to drop them in the chat, and we can answer those as well. But until then, we can jump to the next question that we have here, which is, what does a typical day look like for you in your current role?
So in my current role, it's more of an administrative and supportive role for clinical pharmacists in the field. And so what I do a lot of time is meet with them. We look at cases, we look at certain situations, and I provide clinical support to them. I also assist with designing and executing clinical programs. So an example of that would be hepatitis C patients and linking them to care. So at one of our sites, I support the pharmacists there. We literally extract hepatitis C screening data from the emergency department, and we follow up with those patients and actually link them to a hepatologist or a GI specialist. And we see those patients and ensure that they actually start medication if they are eligible to start medication, and we see them from start to finish. And so I'm looking at all of these reports. I'm supporting these pharmacists, helping them with just the type of conversations they're having with the providers and administrators, as well as their patients. So really designing a lot of clinical programs. That was just one example, but designing those programs, looking at reports, looking at our outcomes, and always looking at continuous process improvement. So that's what a day. I am a remote employee. I do go on site. I'm based in DC, but we have hospital partners all over the country. So I do travel a little, but that's really what my day looks like currently, is meetings, meeting with teams, reviewing reports, and being innovative with programs and different approaches to make sure that we are treating our patients to the best of our ability.
And as for me, as a faculty member, I have introductory pharmacy practice experience students, advanced practice pharmacy students, and I have 3 to 4 days a week on the inpatient psychiatric hospital and 1 morning a week in a clinic. And in the inpatient setting, I'm currently working on an adolescent unit where I round with the team of the mental health treatment team for youth that have been hospitalized post-suicide attempt, or maybe they've got some aggression, or maybe they've got first break psychosis or bipolar disorder, maybe some ADHD or obsessive compulsive disorder that is really severe, that requires hospitalization because of other issues. And I work with my students to help the patients and their families learn about the role of medications. We do medication education groups for the teens, and where they play games and learn about serotonin and dopamine and their role in brain health. And I teach the students how to contribute with regard to note writing about patient encounters. And I'm supervising our resident, our PGY2 psychiatric pharmacy resident, in a psychiatric clinic where we're currently working with patients that have kind of a broad array of medical problems and also mental health problems, but it happens to be housed in an HIV clinic. But not all our patients are HIV positive, but we see a wide variety of cases of psychiatric and medical conditions. And I work with optimizing their medications and documenting in the chart.
And for me, I actually took a recent transition of my career path. To be closer to family, I moved to Iowa, where I'm currently living. But before, I was a pediatric pharmacist in a hospital in Colorado, and did a lot of similar things, kind of on a day-to-day that Julie mentioned, rounding with teams and all those great things. Now, being an editor for Pharmacist Letter, it's kind of taken it to a whole different side of pharmacy, right? Where I'm helping write content for pharmacists to learn. So on a day-to-day basis, I am typically assigned certain topics to look into, research, start writing out articles on that topic. And then I reach out to content experts, just like all of your panelists here today, and share that with them and say, hey, is this right? What do you think about this? And it's so fun to collaborate with so many different minds across the country, because I work right from this desk. And to collaborate that way is pretty unique. And we're talking with doctors, pharmacists, nurses, pharmacy technicians to make the best content available so pharmacists and other staff can keep up their skills. And then on to that, we also make webinars and podcasts on different topics. And there's a lot of background stuff we do with that too. We analyze what are the latest trends that our listeners and readers want to hear about. Are there any other new topics that they recommend our way? A lot of great stuff. And, you know, a couple shifts a month, I go work at the hospital downtown here in Iowa City and get to learn from those pharmacists too, right? And still working in pediatrics, but kind of having different roles all over the place to see how can we make the profession easier for folks to learn and keep up their skills. So it's pretty unique.
So my day-to-day is as a faculty member, but I typically report to the hospital 4 to 5 days a week. So I'll go to the hospital, typically pre-round with my students around like 8 a.m. We round with the surgery team around usually 9 a.m. and that usually takes a couple of hours. Afterwards, we are doing topic discussions, attending presentations, working on research projects, working on their individual projects. And then there's also the teaching in the classroom that comes about every now and then as well. So the activities change on a daily basis, so that's always fun and exciting and kind of keeps me on my toes. So yeah, so that's typical day for me.
Love all of your answers because it just completely dispels that myth that all that pharmacists do is, you know, work in a pharmacy dispensing medication. And while that is a super important part of it, it's not the only one. And I just love hearing your responses to this question. What advice would you give to students who are interested in pursuing a career in pharmacy, or even for current pharmacy students who are interested in pursuing board certification?
So my advice would be to get as much exposure as you can. So that way you know that all the options that are out there. And of course, you won't be able to get all of the exposure, but do your research, leverage technology. This is not available. I graduated from pharmacy school in 2011 and made the decision like in early 2000s. So all of the information that is out here now, just from LinkedIn and programs like this, that was not available to me. So just having the opportunity to know all the different things pharmacists are able to do, I was really limited to what the university was feeding me, which I don't want to say it like that, but different universities you will find have different focus areas. So some really like residency, some really like industry. And so that's what I mean by that statement. And so there are so many other options though. So don't limit yourself in your research and just asking questions. It's so easy to send someone a message on LinkedIn. If you see someone who's a pharmacist who has a position that you think you may be intrigued by, shoot them a quick message, introduce yourself, tell them what you're doing and what you're interested in. A lot of people really like talking about what they do. And so they won't mind like sending you a quick message back in most cases. And if they don't respond, you didn't lose anything. So that's what I recommend, is just not to be shy about doing your research and being open. And the other point I will make is don't just focus on salaries and money. A lot of people make that mistake, and I don't know if that's a big thing still. I know when I was in school, they were giving these crazy incentives to work in certain pharmacy industries. And I would just say the money will come. Focus on like what your skill sets are and what your interests are, and then just, you know, build from there. I wouldn't make that my number one priority.
So I completely agree with Dr. Lewis. Get as much information, as much experience as possible, and, you know, talk about what you're interested in. And I would try to connect with people or make connections with people that maybe you could go shadow them in their particular pharmacy role, whether it's in a hospital, in community, as a consultant role, doing chart reviews, at free clinics. There are a lot of pharmacists that work at different free clinics or patient-centered medical homes around the city, doing volunteering at health fairs and making connections with healthcare professionals that happen to be volunteering at health fairs, and asking if you can come to their setting and work with the pharmacist there and see what the pharmacist does, maybe in that novel environment. I mean, there is just so many opportunities for you to broaden your perspective on the possibilities, the career options in pharmacy.
Yeah, I agree with all of those things. And I would say also be prepared to go with the flow. You never know what opportunities might come your way. I never thought I would have the jobs that I have now. I didn't even know it existed when I was a pharmacy student. So be prepared for those opportunities that come your way and embrace it and lean in when those opportunities arise. And if you don't like it, this is a profession that has so much flexibility in terms of what you can do compared to what my colleagues have told me in other areas of industries and things like that. So that really is a huge plus, just how our profession is formatted. We are everywhere in all sorts of cool things. I'd also recommend don't be hyper focused on these accolades and things like that. BPS is absolutely important. It's a fantastic tool. Residency is a great tool. But some of the best pharmacists I know never did a residency and don't have a certification, right? Do not feel like these things make or break you as a professional. It's what you do in your day-to-day practice that matters. On the flip coin, I know people who have done residencies who aren't the best pharmacists, right? It's a spectrum. So do the best you can do as a pharmacist and don't be hung up on all of these things, because you're going to do a great job as long as you have a passion for it and you love what you do. That's my thought.
And I don't know that I can add anything to all of those statements.
And that's okay, because the next question actually is specifically for you, Dr. Hawthorne. So I think we'll just take it from there. But we had an audience question, which is, when do you recommend pursuing board certification after completion of a residency, and how did you prepare?
Well, I can't necessarily answer that question directly because I was one of the pharmacists that did not complete a residency. So for me, the board certification was a different kind of incentive. So I knew that I wanted to do critical care, but I did not get a residency. And so for me, I needed to work and get experience in order to still pursue what I wanted, which was to do something in critical care. So I was able to get a job in a hospital and got experience clinically. And then I was able to start rotating through the ICU pharmacist rotation and got my experience there. And then, so I think it's 4 or 5 years for critical care that you have to practice before you can sit for the board certification exam. And so once I met that criteria, it was only logically the next step was for me to become board certified. I knew that I wanted to teach, and if I wanted to teach at a respectable institution, then I would need to usually go down the residency pathway. So I had to kind of figure out what my other options were, and board certification was the logical thing to do for me. So I just basically waited the allotted time frame after that. So maybe someone who did it after, who did do a residency might be able to answer more from that side of the conversation.
I could just say that I think residency, right after residency, is the most straightforward path to go for board certification because everything's fresh in your mind. You've got a broad spectrum of experiences and knowledge. And just from doing some research on pass rates of the board exam, for psychiatry at least, those that have done a PGY2 residency have 98, 99% pass rate, whereas the pass rate tends to be lower if you haven't done that second year psychiatric pharmacy residency. I mean, one residency, you still have a stronger pass rate than those that are just kind of taking the specialty exam cold. So I guess I recommend doing going for board certification right after residency if you are doing the residency.
Awesome. And then we had another audience question. What are opportunities, this is to anyone who wants to answer, what are opportunities that exist for someone who wants to pursue pharmacy and research in biotech /pharma? I'm not sure if we have anyone here who would have any thoughts on that.
If no one has thoughts on that, I think what I hear, because we have a fellowship, we have a large fellowship at USC where, I think there's something like 40 slots that we collaborate with different industry partners. And the industry partners all are very clear that they want pharmacists that have some expertise and clinical expertise and knowledge and skills. And they don't want someone that doesn't have those kinds of skills because it really informs your research and informs your role in industry once you have some experience. For example, one of our residency graduates, she spent 5 years at Alameda County Mental Health and worked with teens, worked with adults, worked with health systems, and then went into industry and is very happy in her role in industry. But I think that she was more highly sought after because she did have the clinical experience. That's my take on it.
Yeah, and actually, Dr. Dopheide, this next question, I think you would be good to answer too. Is just generally, how do you recommend gaining clinical experience while in pharmacy school?
Well, volunteering yourself to get involved in projects. There's always so much going on around you when you're in a pharmacy school experience. There are medication use evaluations, quality improvement projects. There's a need to look at the pharmacokinetic dosing. Is it optimal for a particular drug that they're working with? So volunteering to get involved. And volunteering to do literature searches to answer clinical questions that come up for patients. How come this patient's white blood cell dropped and they're on these medications? Which medication is most likely to have caused the white blood cell drop? So there's so many, and you learn so much by answering these clinical patient-related questions or by volunteering your time and services to get involved in these different clinical activities when you are in the pharmacy environment.
Awesome. Here's another audience question. For those with multiple board certifications, why do you maintain them instead of only maintaining one?
I'm happy to join in there. I would say it's, in a way for me, it's to not just to continue learning about those populations. I have to keep up my critical care knowledge, pediatrics, all of that to maintain these certifications. So one, it keeps me learning all the time about those populations. But to me, keeping them also shows my commitment to the diversity of patients I take care of in my practice. Even though I'm a pediatric pharmacist, I take care of kids from 0 days old to kids up to 21 years old. I also work in obstetrics, so I'm dealing with pregnant patients into their late 30s, early 40s. So it's a huge diverse population. And to me, I feel like I need to have those multiple certifications to keep up my knowledge and also show my passion for those populations as well. So there's a philosophical piece to it for me personally, but that's where I come from.
Awesome. We actually have another audience question specifically for you, Dr. Small. This person says, it caught my attention when you had mentioned that you write content for pharmacists to learn. What is the specific role again? And do you need some writing/literature certification for that? Or is it just something you can do without any additional certification? I love to write, so I love to learn more.
I love that. And there are so many writing opportunities in pharmacy. And there are folks that love writing. There are people that despise writing, and that's okay. For me, I knew I loved writing because I wrote a lot of studies and stuff starting in residency, writing papers to medical journals, pharmacy journals, and things like that. And that's something I learned along the way I really, really enjoy. And as an editor for Pharmacist Letter, I'm there to help decide topics that we're going to write about, things that are timely. What's the current news? What's something that's changing in practice that pharmacists should know today to apply to their patients and stay current with what's going on? And that's been really rewarding, and it keeps, frankly, me up on the literature too. What's happening that affects my practice too. So it's kind of a win-win there. And developing that content is pretty important there. And I would say with writing, I would say I'm only one of maybe 3 pharmacists on our staff who have certifications. So it's not required to be board certified, but it does give you a great knowledge base to work from. For example, I get all the pediatric content, right? So it kind of helps, move things along to say, oh, yes, Steve's the pediatric guy. He knows critical care. Well, let's send that stuff to him. But there are opportunities to become certified in writing. There's a whole field of medical writing that pharmacists partake in. I've even debated maybe becoming certified in that outside of BPS in terms of medical writing. And in terms of medical writing, you could be doing things like what I'm doing in terms of news writing, almost content creation for continuing education. But pharmacists write content for companies. They help with advertising, making sure that the advertising is accurate. That's something I actually thought about at one point, is helping with drug advertising because I love multimedia. So getting that certification can absolutely help. You do have to have a certain number of hours in medical writing to demonstrate and be able to take the examinations for those medical writing certifications. But it's a really fascinating side. I don't think we talk a lot about in pharmacy school. And I've known a lot of pharmacists that have gone into that after being clinicians. So you kind of have that nice clinical base to work from, write about it, share with the world. Does that answer the question? I feel like I'm missing a part to that.
No, I think that's great. Thank
That's
you.
great. Great question.
Let's see. Dr. Lewis, this one is for you. How has the field of pharmacy changed since you started your career?
Great question. So the field of pharmacy, from my vantage point, is definitely a lot more technologically advanced. And I also feel like pharmacists, what we're capable of, even though there's still a lot of room for growth there as far as people acknowledging that and understanding that, I do think there's a lot more recognition, and we are being utilized a lot more on the front end of the patient spectrum, opposed to just being viewed as the last stop. And so that's what I really appreciate. And I really do see that from my vantage point, but also other things. Like I see a lot more entrepreneurship in pharmacy and just innovative ways of practicing pharmacy, like pharmacy tech. And when I say tech, I mean technology. And so being instrumental in that way, telehealth, or as Dr. Small just said, even writing, and being someone that's contributing to some of these companies in that way. So I'm really seeing an evolution within pharmacy from when I started, which again, a lot of these opportunities were there, but they weren't spoken about. And I think they were far less numerous as they are now, or far less popular. And so just being able to be an integral part of the team earlier on in the patient care spectrum is one of the biggest things that stands out to me, and not just being viewed as the end user or the last person that they see coming out of the hospital or going to the pharmacy with just a prescription, which is still very impactful, very necessary, and very important. But we are definitely being utilized at a broader scope.
Absolutely. We got one audience question that no pressure, but someone did ask if you guys would be open to giving contact information in case folks have any further questions. And I will just leave that open to you all. If you want to, you're welcome to share it in the chat. Or, you know, you can always share it with me. And then if those individuals want to reach out to me, we can always kind of do an introduction that way. Another audience question that we got is, I'm interested in clinical pharmacy in or outpatient. Can someone expand on the differences from the day-to-day? I heard someone mention that maybe one of them doesn't actually interact with the patient during the day-to-day.
I can take that since I haven't talked for a minute. So in terms of inpatient pharmacy versus outpatient, you are inpatient, you do have kind of multiple roles of the pharmacist. So just like in the outpatient setting, the role of the pharmacist and the pharmacy is to get medications to patients. So you do have a staff and a team down in the pharmacy itself that is making sure all of the operations are running and all of the medications are being loaded appropriately on the patient floors, and that the patients are getting their doses to take while they're in the hospital. But then there's the clinical roles as well. So there's usually a clinical team that is like, I don't really step foot into the pharmacy when I go to work every day. I go up to the 8th floor and I get a list from my team and I work up there. I go to see my patients and look at their labs and do all of that. So and then there's always administrative roles as well within the hospital. So if you're into more of a management or administration, there's opportunities there. Outpatient typically is what you think of when you think of pharmacy, what most people think of pharmacy. So going to Walgreens or CVS, and the pharmacist there is responsible for filling the prescriptions for patients to take at their homes. They'll also fill dose packets for patients who may be in nursing homes or other facilities where we have to kind of pre-package their medications for them. And then there's also different roles, even in the outpatient community pharmacy, like compounding, where this applies to pediatrics or it applies to different dosage forms. So like if you have a patient who cannot swallow and so they can't take medications by mouth, they may be able to compound those into like creams or suppositories or other formats for patients to be able to get their medications still. I mean, gosh, I feel like I could go on forever with a lot of the different outpatients, because there's always nuclear pharmacy and there's infusion pharmacy, where an infusion pharmacy is kind of big right now because we have all of these pop-up like vitamin infusion shops. And I just had somebody message me last week asking if I would come and work. They need a pharmacist to be able to mix their own vitamin bags or something. And so I mean, that's the law. So there's lots of opportunities in so many different realms. But yeah, that's the short version.
One of my students has an infusion pharmacy business on the side as her outside job. So I thought that was really interesting. But I think I was kind of referring to, I chose psych because you have to actually talk to the patient. Sometimes, on my critical care rotation, the patient is too ill to actually talk to. You have to wait till they're better. But if you like really talking to patients, helping them manage their meds, AM care, psych, something where you really have a role of educating the patient that's well enough to speak with you would be something for you. But then the patients who are critically ill definitely need our expertise to get them better. And in the land of the living too, the critical care pharmacists, infectious disease pharmacists.
Awesome. Another audience question. If you get a certification, can you answer pharmaceutical questions to help out in other cases that aren't within your certification?
I can jump
Can you
in for
repeat that
Okay,
question one
go
more
ahead.
time?
Sure. If you get a certification in, say, pediatrics, can you answer pharmaceutical questions or help out in other cases that aren't within your certification?
Yeah, when it comes to questions, it really is based on your comfort level with the material. For example, I'm well versed in pediatric infectious diseases, but if you're going to ask me about like an infection in an 80-year-old, I'm going to say, oh, I'm not your guy. I'm going to refer you to a colleague. So it really depends more on the case, and not so much your certification, but what you're an expert in. And it's really, as a pharmacist, you have to know your limitations, and that's a key thing that you learn as you practice. What are my boundaries? I have very little knowledge about psychiatry. So I'm going to refer those patients to Julie, right? I'm going to reach out to my colleagues and collaborate. That's not saying I'm going to just, dump that patient onto that pharmacist, but it's an opportunity to collaborate and maybe learn some great material from a friend, and maybe apply that to future patients. I'm curious what everyone else thinks.
I love that response. Does anyone else want to jump in on that question before we
I
move on to the
can.
next one? Go ahead.
So I think there's legally, if you're asking from that aspect, yes, legally, you can answer any question that anyone asks you about anything. So just to refer back to what Steve was saying is your comfort level and being able to say, I don't know, or I have an idea, but let me double check what I'm thinking. Like, always want to look it up. I mean, but no one's ever going to be upset with you for answering a question that is not so-called within your expertise, because there are plenty of pharmacists who work in the pharmacy at the hospital who they're the ones getting those phone calls from the physician. Like, if there's not a pharmacist on a particular team and the resident or the physician, attending physician has a question, they're going to call down to the main pharmacy and they're going to ask that pharmacist down there who probably has no certifications. And so they are actually having to field a lot of those questions. So everything's pretty fair game. And I would say that those pharmacists definitely have a more wide array of knowledge than I now do after practicing in one area for like 10 years. And especially for operation things, like they're the ones who do that on a day-to-day basis and can answer all of those kind of questions.
Just hearing you all talk about everything that you know and everything that you do, it sounds like a lot. And so I want to talk a little bit about work-life balance. Dr. Lewis, I'm actually going to have you start us off there. Is how do you balance work and your personal life and your pharmacy career, especially when you have multiple roles?
Sure. So what I will say is, first of all, just understanding where work fits in your priorities in your life, right? So we spend a lot of our quantitative time at work, right? But work doesn't necessarily have to get the best of our qualitative time, if that makes sense. So we all have to work, especially if you work full time. So if we're working, that is what it is. While we're there, we're going to do our best. We're going to do everything we do. So when we're off, though, I believe in being very intentional about knowing what your interests are outside of work, knowing what gives you purpose, whether that be your family, whether that's volunteering, whether that's hiking, whatever that is for you, discovering that thing and being intentional about spending time doing it. So even though you may not get all the time in the world to do this, it could literally be you designating one Saturday a month to go on a 2-hour hike, whatever that looks like. And that really helps with work-life balance. I think when we talk about work-life balance, we focus too much on the actual time. Well, I only have an hour to do this one thing. So don't really focus so much on that, because you're going to spend most of your waking hours at work if you work full time. It just is what it is. So you don't want to get caught up in the actual numbers, but more so the quality of that. So if I have that 1 hour, what am I doing with my 1 hour that I have of just free time, or time that I can do something that I really enjoy, and always having something to look forward to. You're gonna always have work deadlines and all of that. And even though you want to definitely enjoy the work that you do, but you really want to make sure that you have things beyond work that really get you excited, that you look forward to, and that really give you a sense of purpose and drive. And whatever that is, take time to discover what it is. If you don't know, take some time to discover what that is. And it can always change. It changes. Priorities change as we grow, but always have something that you're looking forward to outside of work, and be intentional about making time to do that.
I love that answer so much. I love the quality versus quantity. I wish someone had told me that years and years ago. Um, Next question, though, and that kind of I think flows nicely with this, because Dr. Lewis, I think you would probably make a great mentor to someone just based off of that one response. But would love to know, what role does mentorship play in you all's career, and how can students find mentors? And Dr. Small, I'll have you start on that one.
Yeah, it was actually a mentor in pediatrics that recommended you should really go into this. So I wouldn't be here today without a mentor in a lot of ways. Mentors have great perspective. They've been where you've been, and they can give you kind of some of those ideas of what to look out for. I wish a mentor had told me earlier, don't burn yourself out, just like you were talking about, right? But they can provide those unique perspectives of their career and their journey, so you don't have to make the same mistakes or weird twists and turns that they did. So I think it's a huge part of us as professionals finding a mentor. And in my view, my mentors have always kind of naturally occurred. They're people that I have befriended at work. We have similar interests, perhaps, but there's also more formal options out there. For example, joining a national organization, some of them have sort of formalized networking where you can find a mentor, sort of like a matching service of sorts, where it's like, oh yeah, you have something in common. You guys should meet and talk and maybe share some advice and ideas. I mean, it's an awesome opportunity to do that. Um, and, I even have mentors who are in totally different fields than me, but maybe we have one thing in common, maybe publishing or research that we have that we want to share as well. So it doesn't have to be someone in your specialty per se, but someone who has a really interesting journey, and we all have stories to tell, right? And we love to share those things about our careers. So yeah, I would say it's something to absolutely seek out if you can. And the first step is networking. You can't find a mentor until you have a lot of people to kind of talk to. So reach out.
Absolutely. It's interesting that you say networking, because that is probably the number one piece of advice that anyone who's featured on our Faces of Pharmacy page, which I will link in the chat. 3 of you are actually featured on that Faces of Pharmacy page. That is the number one piece of advice, is kind of that networking piece. And to that, and this question is open to anyone, how do you start off a networking relationship, especially if you're more introverted or shy and you're not really sure how to go about that?
I can answer it. And I wouldn't call myself very introverted, but I suffered with a ton of imposter syndrome early on, because I felt like every group I joined or every person I met was like, well, where did you do your residency? And then for so long I felt like ashamed, or I don't know, just weird, because I feel like everyone had expected me to have done one based on where I am in my career. So yeah, it's been oh, tell me where was I going with this question? What was the question again?
How do you find network, or how do you network if
Networking
you're,
when you're an introvert.
yes.
I'm like, okay, because I'm not an introvert, so I got lost. So I would say the best thing to do is to sign up to do something. Like what I did was I joined like any organization, ACCP or Society of Critical Care Medicine, because that's what my specialty's in. And I signed up for a committee. And so then it was like almost like I was forced, right? Because somebody was emailing me and like, hey, we need to have a meeting. And so then you kind of get into these groups and then you meet other people and you start working on little assignments and committee things together. And then you meet more people and you sign up for other things. And so that's just one easy way to like, so you don't feel awkward sitting next to someone you don't know at a meeting and like trying to initiate these conversations. It starts with business. So
And I really like what Dr. Lewis mentioned earlier, where it is kind of just a leap of faith and do it. You got nothing to lose. Even in my current job, I'm reaching out to random professionals all day. Never met these people in my life. And before clicking that send button, I still get that little like, ooh, is this the right thing to do? But you really don't need to worry about that. What's the worst that they could say? No. And then you say, oh, well, thank you for your time, and then move on. That's something I've conquered a lot because yes, I am also a poster boy for imposter syndrome. That's why I have all these certifications to prove that to myself. Um, but you don't need to worry about that. And really, like we were saying before, a lot of people in this profession, I would say 99% of them want to share their story and provide you with some advice. Maybe they won't be a whole ton of advice. Maybe they will refer you to have a friend like, hey, I got somebody who could definitely help you here. I've had to do that once or twice where I realize I'm not going to give you a lot of good info, but I do know someone who will. And you can refer them that way. So there's such a wealth of knowledge, and just take that leap of faith. It's definitely going to feel uncomfortable at first, but just roll with it. And you're going to learn so much about yourself and others in the process.
Love that. Dr. Lewis or Dr. Dopheide, did you want to add anything? Because it seems like imposter syndrome is something that we all struggle with at one point or another.
Yeah, I would just say the same, just reiterating, don't be afraid to reach out. I know when I started in my last role, I implemented a lot of new things. It was the first of everything, right? And I literally just started reaching out to people who in there, like I would Google like clinical pharmacists that did XYZ, and I would just send them like an email and say, hey, I'm starting this program in my profession. Do you mind sharing with me what you did? And most people responded. And so that was really helpful. And now they wanted to know, let me know how this goes. Let me know if this works for you. And then like Dr. Hawthorne said too, once you assign yourself or sign up for a committee or something, like that's a great way to do it. Like becoming active and just meeting other people who are really doing the same thing that you're either interested in or that you are doing. And most people are willing to help. So I agree with everything that's been stated.
I would just add one brief thing, that it's okay to fail, or it's okay to not succeed or do as well as you thought you would do, because it's a learning and growing experience. I've had things that I thought I was going to really do well at, and then I didn't. But okay, well, maybe that's not my forte, or I learned from it. And I think it really just helps you grow. So try not to get down if things don't go your way the first effort of trying something new.
I think that's actually a really great point to end it on as we come to the top of the hour. I just want to thank you all again for joining us today. Thank you to our panelists for answering all those questions. We had many more. That just speaks to, how interesting this topic is. So hopefully we can have another one of these webinars in the future. But until then, I encourage you all to go to pharmacyforme.org and also visit bpsweb.org to learn more about all of the great career opportunities that are available to you within pharmacy. This recording will be available on the Pharm from Me YouTube afterwards, and I will be sending it out via email as well. And I will link all of the Faces of Pharmacy profiles, as well as the great article that Alex just shared in the chat that Steve contributed. So thank you all again so much for joining us, and we hope to see you at our next webinar. Have a good
Thank
evening,
you.
everyone.
Good night. Thanks,
Thank you so
everyone.
much.